Hey, this is Benny, and this is my segment on topic one, self as a learner, mindfulness and reflection from week 9 of the course content. I chose this topic because mindfulness is something I've always maybe struggled with, even without really knowing what it was. I tend to get caught up in my thoughts, like worrying, overthinking, replaying past situations. Dames describes mindfulness as being present in the moment and not letting yourself get so caught up in constant worry, and I do tend to do that. They go on to describe that mindfulness is a shifting away from a thinking mode and into a sensing mode, that you're feeling your emotions and you're present in the moment, so that later you can reflect on how you felt afterwards. And yeah, I realize that I do need this skill. The idea of grounding myself in the present instead of being pulled away by stress really resonated with me. So this is why I knew this topic was important, not for just school, but also for the kind of nurse I want to be, as I want to be present in the moment with my patients. So I think the biggest learning for me was understanding how mindfulness and reflection actually work together. Mindfulness helps me notice what is going on internally, and reflection helps me make sense of it afterwards. The research by McVeigh et al. Strengthened this understanding. They found that a mindfulness based intervention significantly reduced stress, anxiety, and emotional distress in undergraduate nursing students while also improving their attention, self awareness, and coping abilities. So it has a measurable benefit for nursing performance and well being. So the second article by Stephen et al. 2020 really expanded my understanding of what meaningful reflection actually looks like. The review of critical incident techniques showed that true reflection goes far beyond simply recalling an event, and that when students are able to analyze clinical moments that were both positive or negative moments, they begin to uncover their assumptions, their biases, and emotional reactions that shape their behavior in that moment. Um, they go on to explain that this process helps the student move from more of a surface level recounting into more of a deeper self awareness. So they can clearly see how their values, their stress responses, and their decision making patterns influence their patient care in that moment. So I think mindfulness and reflection connect to a couple pillars of the 6 pillars of health, especially stress management and the social connection. When I'm more mindful, I'm more present with the people around me and the actions around me, and I don't let the stress dominate my mental space. Professionally, mindfulness can help me stay calm and centered during challenging moments, while reflection can help me learn from those experiences afterwards. These practices strengthen therapeutic presence, emotional regulation, and my resilience. And these are all essential for myself as a developing nurse. And then just some lingering questions that I may have is really how do experienced nurses apply mindfulness in real time during emotionally heavy or fast paced events that might happen in practice? I'm curious about how long it takes to build that skill and what strategies nurses actually use on the floor. And these are things I hope to learn a bit more in my clinical placement this coming winter. And then, sort of just as a final reflection, topic one really did just teach me that mindfulness and reflection aren't just abstract ideas. They're practical skills that I can integrate in my daily life and into my clinical practice as a future nurse. Um, and then that mindfulness just helps me stay, grounded, and then reflection helps me grow from these experiences that I face, negative or positive. They're foundational tools for becoming present and self aware and ultimately a compassionate nurse.